brain problems older Malaysians may face.
In Malaysia right now, the number of people above the age of 65 are increasingly larger. And with that, then you're bound to have certain neurological conditions that comes about with increasing age. Now, as the brain ages, anatomically, there is some shrinkage of the brain cells. This does not translate into functional impairment. Although we see in an MRI of a person who's about 80 or 90 years old, the brain has shrunk, it may not necessarily translate into functional impairment of that particular individual. But from the anatomical standpoint, yes, the brain does shrink over time, and with shrinking brain can result in certain neurological conditions that may cause certain impairment. These conditions can include things like Parkinson's disease, Alzheimer's disease. Patients can come in with chronic subdural hematomas, dementia, memory loss, memory dysfunction, and also certain conditions where trivial traumas can lead to blood clots forming in the brain. Unlike younger individuals where the brain has not shrunk yet, any blood clot that forms into the brain causes an immediate deterioration in conscious level. In the elderly, because of the fact that the brain has shrunk, there's more empty space within the brain. A blood clot that forms in the brain doesn't show up that quickly. We have elderly mothers and fathers and uncles and aunties who may have had a fall at home, just tripped over his carpet and fell down, knocked his head against the wall or against the floor. A bit of bruising, but nothing other than that. But slowly, tiny blood vessels within the brain would have ruptured, and there will be slow ooze of blood within the brain will form a clot, which will develop slowly over time, over a period of 1 to 2 or sometimes 3 weeks. Only then do we realize that they actually are symptomatic. They'll complain of headaches, giddiness, lapses in memory, confusion, weakness and numbness, and only then you find out that something has happened. And the cause, the actual event that caused it would have occurred 2 or 3 weeks earlier, and most of the time patients don't remember that they actually had a fall. And when they come to the hospital, a scan is done and we find that the patient actually has a very large blood clot in his brain. I think one of the easiest analogies is as you get older, the amount of care that should be given to our parents or family members who are older is similar to the amount of care that we give to our own children when they're young. When our child falls off the bed, suffers a bump on their head, the first thing that we do is bring them to the hospital because we are worried. A child's brain is very fragile, damage can occur quite quickly. Similarly, the same analogy applies to elderly people. Their brain is fragile. Damage can occur rather quickly. So my best advice is if there's any suspicion that there may have been a trauma, just come to the hospital, get it checked out, because that will save you a lot of future problems if it was not detected earlier.